Hello, this is Robert Menard of the Northern California Kaiser Permanente Craniofacial Clinic. In this program, we will be looking at the many types of occipital flattening, or abnormal head shapes, that result from how babies are positioned inside the uterus and how babies are positioned during the first few months of life. We will discuss the different treatment options available for infants with this condition. We will also review methods for prevention, as this information will be helpful for both preventing and reducing further flattening. Let's begin with the structure of an infant's head. Looking at the top of an infant's head, you can see the 5 bones which make up the growing skull, or cranium. The connections between the bones are called sutures. In infancy, the cranial bones are thin and the sutures are soft, which let the cranium bend as it passes through the birth canal. The space between the skull bones allows for the rapid growth in brain size that we see over the first year of life. Depending on how a baby is positioned in the uterus or after birth, he or she may develop a flat spot on the back of their head, either on the right or left side of the back of the head, or squarely in the middle of the back of the head. To reduce your baby's risk of SIDS, or sudden infant death syndrome, the American Academy of Pediatrics has recommended that parents put babies to sleep on his or her back. While this increases the risk for developing a flat spot on the back of your baby's head, affecting 1 out of 5 infants, the benefits outweigh the risk of a temporary abnormal shaped head. Why does this flattening happen? It is a result of outer molding forces on an infant's skull, which reacts to pressure like a cardboard box. Here we see a 3D CT scan of a baby with a normal-shaped skull and a cardboard box. When pressure is put on one side of the back of the head, there is compensational bulging on the opposite side of the back of the head to help the growth of the brain. This flattening is a safe process, which results in a cosmetic deformity of the skull, and there is no strong medical evidence that untreated flattening has any medical or mental concerns for infants. Here we see a baby with right posterior cranial flattening, resulting in a right forehead that stands out, movement of the right ear forward, and bulging of the left side of the head. This is known as deformational plagiocephaly. This baby has symmetrical posterior flattening, causing widening of the head shape from side to side and making the head shorter from front to back. This is known as deformational brachycephaly. Unfortunately, we cannot know beforehand which infants will get major flattening, but we do know the risk factors include being male, being firstborn, having a preferred sleeping position, being fed in the same position, often during bottle feeding, and tummy time when awake less than 3 times a day. Torticollis. Sometimes babies get flattening or asymmetrical head shapes because of tight neck muscles. This means babies may not have the neck strength to turn their head the other way. Lying on one side can contribute to flattening or abnormal shape of the head. Lastly, a delay in reaching certain motor milestones, such as the skill to roll the head off of the flattened area, is a risk factor as well. The following can prevent and may decrease flattening. Reduce the amount of time your baby spends lying in one place. This includes on a mattress, in a car seat, on the floor, or any firm surface. Modify sleeping positions. All babies should be put to sleep on their backs. You can change positions by placing your baby's head at the opposite end of the crib on alternate nights. This will encourage your baby to turn his or her head a different direction every other night when he or she turns towards the sound of your voice. Carry your baby in your arms, sling, or other carrier more often. Provide tummy time each day during playful awake hours. Tummy time relieves the pressure on the back of the head and increases neck strength. Tummy time is essential in preventing plagiocephaly in infants. You should begin tummy time as soon as you take your baby home from the hospital. Tummy time helps promote motor skills development, such as rolling over, sitting, and crawling. It will strengthen your baby's neck, abdominal, and back muscles and make your baby stronger. To encourage tummy time, place your infant on their tummy on a towel or playmat on a solid surface such as a floor or crib. Place a toy in front of them and engage your baby in play. Do tummy time as often as possible when your baby is awake and not hungry. Place mobiles and other interesting toys so that your baby must turn away from his or her flat side to see them. Rearrange furniture in your baby's room. Even very young babies are attracted to light and will try to turn their heads towards a window. If your baby sleeps in your room, set up the bassinet or crib so that he or she must turn away from the flat side to see you. We do not recommend any kind of support or device that restricts baby's head movement. Do not use wedges or sleep positioning pillows, as these can be unsafe. Switch arms each time you feed your baby, whether you bottle or breastfeed. By alternating arms, you are placing your baby's head in a different position. We can usually diagnose the cause of an abnormal shaped head by viewing and feeling your baby's skull. We will ask about your baby's regular sleep position and possibly measure his or her head. Try to remember that your baby's head, if due to positional molding, is not a concern for overall health. Plagiocephaly is only a cosmetic issue. Treatment for infants with deformational plagiocephaly and brachycephaly include 1. Positioning and observation over time, as discussed with prevention. 2. A referral to physical therapy for care of torticollis, if present. And 3. Orthotic molding helmet therapy, if indicated. Most infants' flattening will disappear over the first 4 to 5 years of life with time and positioning. If your baby has weakened neck muscles and prefers to turn his or her head to a particular side, we may recommend physical therapy and home exercises to help strengthen the neck muscles in your baby and add to the range of motion in their neck, which will help keep them off the flattened area. Babies with more major flattening of the head may be referred for helmet therapy or orthotic cranioplasty. This device relieves pressure and can help reshape your baby's head and must be worn 22 hours a day for at least 4 months. Babies are often referred for helmet therapy between the ages of 4 and 9 months. The helmet is designed to specifically fit your baby's head. The foam that lines the helmet is removed over the flattened area to allow for growth into the area, and change is often seen within 4 months. You will need to check with your health plan to see if it includes coverage for these helmets. Most mild cases of plagiocephaly improve with the treatments described above. If major levels of flattening are seen in your baby, you can choose to go with elective helmet therapy or to follow a course of care of positioning and observation. On behalf of the Craniofacial Clinic and Kaiser Permanente, I want to thank you for taking the time to view this presentation. If you have any questions, feel free to contact your pediatrician. We look forward to caring for your child.